In this video, I'm going to talk about rapidly progressive glomerulonephritis, also abbreviated RPGN. And before we get into the big long talk about this, I think it's important to draw a diagram of the nephron, which most of you know is the unit component of the kidney. So here's a basic diagram of a nephron. And here is the glomerulus. Let's clean this up a bit. Right there. So that's their glomerulus. Now, when you have diseases of the glomerular diseases, what's happening is you have a problem at this level, and what that does is normally when blood comes, it's filtered, and eventually the waste products are excreted in the urine. Now, large molecules are not supposed to come out into the urine. Large molecules don't pass through the glomerulus. So if they do, that means there's some sort of problem, some sort of pathology in the glomerulus. And which large molecules are those? Well, you have red blood cells, protein, and lipids. So these are not supposed to be in your urine. So if they are in your urine, if they show up, like for example, if you have blood in your urine, red blood cells, or if you have protein in your urine, or lipids in your urine, then that means there's a problem at this level here, because large molecules normally don't filter through into the nephron. They're too big. Now, there's two types of glomerular diseases. Well, there's many types, but there's two main categories. The first is called nephritic, with an I, and the second one is nephrotic, with an O. They sound similar and spelled almost the same, but there's one letter difference, and that makes all the difference. So let's start with nephritic. Nephritic refers to that there's inflammation here. So that's nephritic. And that glomerular inflammation can lead to red blood cells and protein passing through and getting into the urine. The next type is nephrotic. Now, nephrotic is basically a situation where you have no real inflammation, but you have abnormal permeability of this glomerular membrane. So let me write that down: abnormal permeability. And what that essentially means is that molecules that are not supposed to pass through are passing through. Abnormal permeability. There's no inflammation per se, but there's abnormal filtration going on at this level of the nephron. So those are the key differences between nephritic and nephrotic. And in this video, we're talking about RPGN, which is a type of nephritic disease. Nephritic with an I. Okay, so since it is a nephritic disease, we essentially have an inflammation component, glomerular inflammation going on. So what are some of the symptoms? Well, basically, some very non-specific symptoms. For example, we mentioned earlier that you'll have blood in the urine, so you have hematuria. Because you have kidney damage, this disease is affecting the kidney. Anytime you have kidney damage in the body, you're going to have symptoms like fatigue, nausea, vomiting. Those are very non-specific symptoms that are associated with kidney disease. Also, you can have fever, because one of the reasons you get RPGN is because of an infection. We'll talk a little bit about that later on when I present a clinical vignette. So that's why you get the fever. So those are some of the basic symptoms. They're not very specific, but as we go along in terms of this disease, and once we get to the diagnosis, it becomes much more clearer. So now we have diagnosis. So how do you diagnose this? Well, anytime you have hematuria, you want to test the urine. And when you test the urine, you're going to see in the urine red blood cells, and in particular you're going to see red blood cell casts. Casts are cylindrical molecules that are seen in the urine, and an RBC cast is essentially a cast with an RBCs inside, or fragments of RBCs. BU and creatinine are very standard kidney tests. I mean, those are done all the time, and the creatinine level will be high. Because BU and creatinine will both be high, because you're in a state of renal disease. So that's pretty straightforward. The next thing is, one of the reasons this can happen is because it can occur as a result of an autoimmune attack on the glomerulus. So you have certain antibodies that actually attack the glomerulus. So you can test for those. You can do blood tests, and there's several. There's quite a few actually. There's anti-GBM antibodies, there's anti-streptolysin O antibody, anti-DNA antibodies, so quite a few, but I just wanted to mention that. And then the most specific test to diagnose this is the renal biopsy. And what the renal biopsy will show is that it will show essentially the histologic evidence of damage to the glomerulus. So, show histo evidence of RPGN. That's a very specific test. So now you've diagnosed it, so how do you treat? Well, inflammation is the hallmark. Glomerular inflammation is really the hallmark of this disease. So that is treated with corticosteroids. And in particular, if it's adults, it's usually high dose because adults tend to have a worse outcome. More worrisome outcome. Another drug that's used is cyclophosphamide. And then another method of treating this is plasma exchange. What plasma exchange means is essentially you're replacing the patient's plasma with new plasma, and what that is believed to be effective because it removes those antibodies from the person's bloodstream and replaces the blood that contains the antibodies with blood that doesn't contain the antibodies. And if you recall, those antibodies are attacking the glomerulus. So that's why this is highly effective. So just to recap, RPGN, rapidly progressive glomerulonephritis, is basically a nephritic syndrome. It's basically characterized by glomerular inflammation, and that can lead to symptoms such as hematuria, blood in the urine, fatigue, nausea and vomiting, fever because RPGN can sometimes be caused by an infection. Diagnosis: well, like any kidney disorder, you do the BUN creatinine, that will be high. You check the urine for red blood cells and red blood cell casts. It's very important. You do blood tests that can detect those antibodies that are actually causing the glomerular damage. And then the most specific test is, of course, the biopsy. The antibodies directed against the glomerulus can result in the inflammation, so that's why you test for those. And then the treatment, you've got steroids, most effective, cyclophosphamide, and plasma exchange. And that's the very basic summary. So now I have a clinical vignette here. I'll present that to you. A 40-year-old man is admitted to the hospital for acute deterioration in renal function. He was seen at your office 2 days prior for some mild upper respiratory complaints, including a sore throat, cough, and fever. So it sounds like he had an infection. He was prescribed cephalexin, antibiotic, sent home. Today his lab data returned and showed blood urea nitrogen level of 67 and creatinine of 2.1. You call him and told him to meet you at the hospital for further evaluation. On admission, his BUN is now 109 and creatinine has jumped up to 4.2, so he's obviously in some sort of renal failure. Appropriate tests are ordered. EKG shows QRS complex widening and tall peak T waves. His temperature is 101. Erythematous oropharynx. Some mild tonsillar exudate. Lungs are clear. Observed that he has urinated only 5 to 10 cc's in the past 2 hours. So he's got some oliguria. Urine analysis shows red blood cell casts and dysmorphic red blood cells. The most appropriate next step is 2. So there's no doubt that he's got glomerulonephritis, which was caused by an infection, presenting with renal failure and some symptoms, fever, and some very, very specific test results. So what do you do to treat this? Well, choice C and D are talking about giving him antibiotics. Well, he's way beyond this. He's not just in an upper respiratory infection state. He's now into renal failure. So those are gone. So now you're left with cyclophosphamide and prednisone. Cyclophosphamide actually is reserved for more dramatic immune suppression in patients with more severe disease. And it's not really the best to use initially. The most appropriate next step is to use steroids. Now, because he's an adult, the outcome actually of RPGN in adults is much worse. So early initiation of high-dose steroids is associated with the best outcome. So that would be choice A.